I have never been more proud of nurses and nursing at Texas Children's than I am today. We have a great group of nurses.
I admire their resilience. I think about the past year, we've had high acuity, we've had high census. We're trying to make sure our patients have the best experience while they're here. We've had staffing challenges, all of those things, but through those things, these nurses remain committed.
We interact with patients on a level that not all care providers get to. They trust us, we educate them, we teach them, we give them their medications.
We're always someone that the patients and families can rely on to be a support system for them.
Nurses are the only care provider that's at the bedside 24/7. They are key to the patient experience for families. They're key to improving the outcome.
They help us identify gaps. They help us identify the risk points. They help us select products. They help us to identify where we may, as leaders, may have missed the boat, and that we have to course correct and rethink, our action steps.
Our nurses are leaders.
You think she's comfortable right there? Yeah. Okay.
Which one of these faces shows how you feel right now?
He likes chocolate milk.
You like chocolate milk?
Mm-hmm.
We have nurses involved in a lot of significant healthcare initiatives to improve outcomes. We have nurses that are working diligently to try to prevent what we call hospital-acquired infections in central lines.
We lined out a massive educational initiative for the nurses. Almost 2,000 nurses in the end were trained.
We went through hand hygiene, we went through cap changes, dressing changes, just accessing the central line.
In the NICU, we've seen a tremendous decrease in our CLABSI rates since the time that the educational initiative was implemented and through the time that it was completed. And that decrease is also present across the institution.
So the nurses in the Pavilion for Women in particular have really geared together and worked together really closely with the peri-op and labor and delivery to try to actually reduce surgical site infection. So they've developed a whole bundle, and they've initiated it and actually have really made some significant success.
When you think about the locations of care, when you think about the opportunities that a nurse can have here, this is the right time to be at Texas Children's. You can work in any part of Houston's community.
Texas Children's Pediatrics, the West Campus, urgent care centers, our freestanding health centers, our centers for children and women.
Nurses at Texas Children's can advance clinically, in research, in administration, and leadership.
I was able to move from just being a bedside nurse to working with transport team and going out to get patients at outlying hospitals, bring them back here for more definitive care.
I was here as a student during my capstone in nursing school, and I think about going somewhere else, and I just can't imagine wanting to work any other place.
We always have support by everybody, by our management, by our directors.
But what's so exciting is not just about where we are today with nursing, but the future of nursing at Texas Children's Hospital, with the Woodlands, with Tower E.
Okay, everybody, we're going to get started with the simulations.
We're able to do simulation. We're able to take a warehouse room and make it look like a critical care room. That is a prototype of what we think our Care First room will look like in our new Tower E. The great thing about this project is nursing is shoulder to shoulder with our physician partners and administration to make sure that building is driving the best outcomes for our patients and families.
A new council is formed. It's called the Innovation Council, and it's run by staff nurses.
It's a place where a new idea can take root and grow and be nurtured and hopefully one day produce measurable outcomes for patients and their families.
Every day should be a day to celebrate our nurses because every day they change lives.
Our nurses are a critical element to care delivery, and we value them and their contributions every single day.
They give of their heart and their soul to our patients and their families.
We want them part of our team, not only for a year or 2 years, but for their entire career.
Thank you so very much for what y'all do every single day for Texas Children's.